you say that there's some trauma things we need to talk about with stroke, and I think that's a great one here. And so, who doesn't love trauma? The risk of stroke and trauma. Tell us about it.
So it's interesting. And it's funny that I think about a story where a patient who was in a motor vehicle crash, pretty high mechanism, presented with stroke-like symptoms, and everyone assumed, that the crash was caused by the person having a stroke. And we do see that, right? We see it all the time, like syncope crash, stroke crash, right? Because you lose control of the vehicle, and that can happen. But the assumption was the crash happened because of them having an antecedent stroke or preceding stroke, and then they crashed their car. However, again, talking about posterior circulation and those sort of things, we see in the setting of trauma and usually high mechanisms. When Dan and I were children in the dark ages, when we were still developing knives and forks and things right? We were young as young paramedics together.
Yes, long ago.
Well, long ago in a galaxy far, far away. But anyway, we were kind of in that mode of, seatbelt signs, and we saw a seatbelt sign on someone's abdomen. We said, "Oh, back injury, chance fracture, intra-abdominal injuries, hollow viscous, solid viscous, those sorts of things," right? And now that there are almost no lap belt only vehicles left on the road, occasionally a rural community might have an old F-150 out there that has it, but generally we don't see just isolated abdominal seatbelt signs. But we do see a lot of seatbelt signs up high riding seatbelt signs, right? Above the clavicle in this area. So you take a look at someone's neck, and a good trauma exam needs, before you throw the collar on someone, expose this stuff out. Do you see a high riding seatbelt sign? And what's really emerged is interesting is that seatbelt shoulder straps from seatbelts can cause direct vascular injury in high mechanism. So if you have, you normally wear seatbelts, like, my Volvo, it pulls me back, don't get seatbelt signs. If I see a seatbelt mark on someone's neck, when they get to the trauma center, they're getting specific different studies of their neck. We do CT angios of their neck to look for injuries to the carotid arteries, anterior circulation, and the vertebral arteries, posterior circulation, because you get these interesting injuries where there's damage to the vessel. It's not like it's ripped in half, but you get these flaps, intimal flaps, because of trauma and the energy directly to the blood vessel. And they may stroke because of that. So you'll see these patients come in with stroke-like symptoms, high riding seatbelt signs. And they did a study a while ago, and it's not like every one of them by any means. It's fairly unusual. Maybe one in 75 or 100 stroke scans that we do, or excuse me, angios we do when we see this thing. But when you find it, it's really important, because if they're neurologically intact now, but they have this intimal flap, this new sort of like thing going to cause turbulence and clot in their neck, in their carotid, or in the vertebral artery, we need to know about that and start treating that right away. And interestingly, in the setting of trauma, the way you treat a intimal injury after a carotid injury or a vertebral injury where there's this intimal flap floating around, we actually put them on antiplatelet agents. We make sure they don't form clots on this flap. Rarely is it repaired, but normally they go on it's kind of counterintuitive. You're thinning people's bloods out, so to speak, who are trauma patients, but you got to find that injury. So really, really important. And again, another quick case story. The patient who was in a motor vehicle crash 2 days ago, and I remember this case like it was yesterday, Dodge Neon, one of those little vehicles, car was decimated. The patient refused transport, but they had a big seatbelt mark up in here, but still refused transport. And 2 days later presented with stroke-like symptoms because they stroked, because they had the injury at the time of the crash. Took a little while for those platelets to junk up on top of that ripped part of the artery, and then they stroked. So again, really, really important.
So that kicked loose. That clock kicked loose.
Yep, that clock, and it traveled, right? And it's not a hemorrhagic stroke; it's an embolic stroke at that point, which is really interesting, right, in the setting of trauma. And I think it's the exact same thing I said about the TIA, right? You go to a person, you say, you really need to go to the hospital. You're going to talk to my doc. I'm not going to let you go until you talk to my doc to make sure you understand all the risks. You could have a real stroke here, and you could end up, permanently being, with a feeding tube, and a disastrous sort of thing, and dead even. Same thing in motor vehicle crashes. When I see somebody who's signing off against advice, and I always look at their neck before I have them sign the paper. Can I just look at your neck real quick? And I see a seatbelt sign, I'm telling them, look, that's worrisome. It may not be that injury, but the fact that there's that much energy applied to your neck and do a lot of damage down deep, this is not the time to blow it off and say, because I know I'm already in trouble because I crashed my car. You need to go to the hospital, get a good evaluation, make sure there's nothing else going on.
Wow. I think that there's really an incredible amount of things we've talked about here that could change practice in EMS. I mean, I don't think there's a lot of people that look at that seatbelt sign and make the connections that you just made there.